Well, it's time for our health report. Joining us now is Africa 54 health correspondent Linord Moudou with a look at family planning. Hello, Linord.
Hello, Vance, and hello, everyone. The United Nations is holding the 47th session of the Commission on Population and Development in New York this week. Participants are assessing progress made on gender equality, universal family planning, and sexual and reproductive health services. Governments are also discussing ways to address population growth while supporting human rights and sustainable development. And joining us now from the UN is Ruth Kavuma, a former member of the Ugandan Parliament and member of the African Women Leaders Network for Reproductive Health and Family Planning, AWLN. Mrs. Kavuma, welcome to the show.
Thank you.
So according to UN statistics, Africa has the highest mortality rate in the world with 56%. Can you give us a sense of what is happening in your country, Uganda?
Well, Uganda is not any different from, what the African countries, what we know about the African countries. In fact, unfortunately, I think it's one of number 1, 2, 3 in Africa, and infant mortality and very high birth rates. I think leading in the birth rates about 3.2% every year. Which is very, very high. So, of course, that's why as us, the Africa Women Leaders Network, there are about 4 or 5 of us in Uganda. We're trying to work on making sure that we advocate for the provision of family planning supplies and also go to the public and help them to understand the reasons why we should plan our families. One of the biggest hiccups is the way people perceive the modern family planning. In most cases, they think that modern family planning is not good for them.
Such as what? When you talk about modern?
Modern, like contraceptives.
Contraceptive, yes.
They all talk about the side effects of contraceptives. And quite a number of them, the people who give the services, don't explain to them the advantages. So this is what we are trying to work at, to make sure that we advocate for the services and the rights, but at the same time, let the people know. I mean, it's like a contraceptive has a side effect. To me, it's exactly the same as somebody would say, if you take aspirin, you'd get ulcers or something like that. So these are the things we are trying to look at as advocates.
Okay, as a group, advocacy group. Now, quickly, before we go, because we're running out of time, unfortunately, can you tell us what type of impact have you seen through your work? Very, very briefly.
Well, I think we've done very well because we've worked with the Ugandan Parliament and managed to influence the budget for contraceptives and other family planning facilities. And the budget has really been, has increased. We also managed to get a World Bank loan in order to make sure that we go straight into this area. I think we've really done very well in the area of influencing, because if you don't influence the policy makers, then you don't get anywhere. There may be a lot of demand on at the grassroots, but the policy makers have to budget and make sure that the facilities are there. And
Mrs. Kavuma, as a policymaker, former policymaker, you can attest to that. Thank you so much for joining us today. We appreciate your time.
Thank you.
And that was Ruth Kavuma, a former member of the Ugandan Parliament and member of the African Women Leaders Network for Reproductive Health and Family Planning. Now to Kenya, where Nairobi-based artist Michael Soy is partnering with the Center for African Family Studies to create funky condom wrappers to promote safe sex among young people and decrease new HIV infections and unplanned pregnancies. Talking sex with strangers on the streets of Kenya's bustling capital, Nairobi, staff from the Center for African Family Studies, CAFS, convince a young man to buy a condom. CAFS aims to promote safe sex and prevent unplanned pregnancies among the youth. The organization says these condoms are grabbing the attention of the youth like never before.
I think it's a gap that needs to be filled in the country, because that was actually the first time we had youth calling CAFs to ask for just condoms. Not even about our programs, not about our training courses, but just the condoms.
The condoms, discreetly packaged in a colorful wrapper, offer something different. The artwork of popular Kenyan artist Michael Soy. His edgy themes, cartoon style and bold colors have earned him a reputation as one of East Africa's top pop artists. Soy says the project came to him naturally.
I create work that revolves around commercial sex work. I create work that revolves around issues that surround the youth. So, this came in as something very interesting for me because, HIV and AIDS is something that basically affects the youth. So, I thought that it would be interesting to kind of make a contribution towards the project.
CAF's hopes that Soy's message will influence Kenyan youth who struggle to talk about the challenges of their sexuality in a largely conservative society.
It's flashy, it's artistic, so to say. It's really what people are looking at right now in terms of graphics, in terms of telling a story, which he does with his art on youth and society.
Statistics show that Kenya has made some improvements in tackling HIV/AIDS. The country's HIV prevalence has dropped by about 2% in 5 years. The special condoms are targeted to the youth, retail for $1 per pack of 3. The Center for African Family Studies says the young people need more awareness and reinforcement and hopes that having little pieces of art in their packets translates to safe sex.
Interesting way there to raise awareness. Well, that's our Africa Health Report for today. Back to you, Vincent.
Thanks a lot, Linord. Be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.